will demonstrate a basic interrupted suture. Tear the suture packet open as shown and grasp the needle with the needle holder. It is important to never use your fingers when handling the needle, but instead use the needle holder. If you wish to alter the position of the needle in the needle holder, use the forceps to hold and reposition. Grasp the needle about 2/3 of the way along the circumference. Grip the needle within 2 mm of the tip of the needle holder's jaws. Insertion of sutures requires a smooth supination of the forearm. Take a suture and insert the needle at right angles to the incision using counter pressure from the forceps. Rotate the needle through the skin and pull the suture through gently without snagging. Tie with a standard reef knot, either using the one-handed technique or an instrument tie. Please see our collection of videos for further instruction. Cut the suture long so that it can be grasped firm for easy removal. Too long and the suture may get caught up in the wound and is a waste of suture length. Too short and the knot may become insecure or make for difficult removal after healing. As a rule, the distance from the edge of the wound should correspond to the thickness of the tissue being sutured. Successive sutures should be placed twice this distance apart, approximately double the depth of the tissue being sutured. Here we are trying to approximate the skin edges without strangulation of the tissue. When the incision edges are as closely aligned as these, it is appropriate to go through edges with one smooth movement. However, wound dependent, this is not always possible. When first getting to grips with basic suturing, or with more complex wounds, taking the skin edges separately may be more suitable. Once the wound is closed, ensure that no knots lie over the suture line. When interrupted sutures are removed, you should avoid dragging the suture through the skin and tissue, as the suture will be contaminated. Use a suture cutter or a pair of surgical scissors. Cut the suture close to the skin at the insertion point opposite the knot. Pull the knotted side using the forceps to remove the suture.